Hi, it's Dr. Greg Jantz. I'm a counselor. I am an individual who loves to talk about sleep. Well, and dreaming. I used to work in a sleep research laboratory, though years ago, prior to founding the Center, A Place of Hope. And I always had a great interest in sleep, how it affects our mental health and our emotions. But then there's the topic of dreaming and how dreaming and REM, rapid eye movement, otherwise known as the dream stage, how does that factor into our mental health? And why does REM sleep and dreaming matter? Well, REM sleep, what is it? It's the stage of sleep where most dreaming occurs. Our brain is active, the body's relaxed, and a lot of emotional processing happens then. Number two, it's emotional memory processing. The REM period and dreaming helps your brain make sense of emotional experiences that release tension. And this is important. We do need to dream. And you'll probably say, well, I don't remember my dreams. Dreaming is important. Dreaming is indeed a part of healthy sleep. The other factor to look at is what we call mood regulation. Poor or disrupted REM has been linked to anxiety, depression, and emotional instability. Anxiety, depression, and emotional instability. So that's poor or disrupted REM sleep. Now, I just want to mention, how does trauma affect our dreaming? Vivid or disturbing dreams can be a factor for somebody who's had trauma, or you've had some significant abuse, and the dreaming of that can make it so scary that you don't even want to go to sleep. The dreaming can be so vivid and seem so real. It's an intense, distressing dream. There's the reoccurring nightmares. Post-traumatic stress and trauma-related stress can interrupt REM sleep and prevent emotional healing. So, reoccurring nightmares, it's waking you up. Then we know that this is important. Why? Well, without restful dreaming, our brain does miss, and I put down here, a key opportunity to regulate and repair itself. So, dreaming is important. There are psychological benefits to dreaming. Dreamings at times can be seen as a mirror. They can, and this is where we need to be careful, but they can reflect unresolved emotions, giving us insight to what your mind's working through. Sometimes people feel like they can problem solve in their sleep. The dreaming brain can help us mentally rehearse difficult situations and really find clarity. There is the creative insight. Many artists, writers, thinkers tend to credit dreams for like that creativity that came to me when I was dreaming. So here's a couple tips: how to improve REM sleep and dream health. Okay, you've probably heard this before, but it's sticking to a schedule. Regular sleep and really does improve the quality and depth of the REM cycles. Regular sleep does improve the depth and quality of REM cycles. We know that avoiding stimulants, caffeine before bed, caffeine, alcohol, eliminating screen time before bed can help promote easier sleep cycles and getting into that restful sleep, the dream cycle. All right. It's also interesting to track your dreams. Maybe it's a dream journal, and just look over a month, 2 months, just tracking process and patterns that you may see or themes you may see in your dreams. All right. The question always arises, when do I seek help? Well, nightmares that are so consistent that they're disrupting your sleep to such a degree that you're not functioning well, that's a sign. And if disturbing dreams continue to affect our well-being, could be a sign of underlying trauma. Sleep disorders and mental health. Chronic insomnia. Night terrors. There's the disrupted sleep. So this is another, so when sleep disorders are disturbing your mental health, where there's so much anxiety, your appetite's been affected, and there's depression, that's a sign. And we do what we call sleep studies on clients who come to us at the center, a place of hope. We want to know the sleep cycles. We want to know, is there sleep apnea where you stop breathing? We want to know how much are you spending adequate time into that REM sleep. So to analyze your sleep can be really important as a piece to recovery and mental health. So it's something we look at, and we know the importance of sleep and our mental health.